let's talk about autism is one thing you didn't mention. You do have a blog. It's a brief one, but I'm sure you cover it in the book. How is autism or the autism sort of the spectrum even linked to metabolic health?
Oh gosh, so one of my big interests is the gut-brain connection. So we have a lot of research out there showing just the very close links that happen between our gut and our brain. And obviously it matters what we put into our gut because it's the interface with the external world. When whatever we eat comes in direct contact with our gut lining. And there are some very good studies showing, particularly in populations with autism, that they have a higher prevalence of leaky gut or increased intestinal permeability. And the reason that this is relevant to mental health is that we know from the research that when you have leaky gut, it means that toxins, bacterial toxins, food particles can cross over the gut wall and enter the bloodstream, and then they can travel to sites distant within the body. And they trigger off an immune system reaction when that happens. So you have release of inflammatory cytokines, which are a certain type of immune molecule. And we know that when that happens, there's evidence to suggest that our blood-brain barrier, which is a very similar barrier to the gut, but it's the interface between the brain and the systemic bloodstream, it can also become leaky. And when it becomes leaky, because of this cytokine storm and the immune reaction that happens in the body, then it means your defenses around your brain are partially broken down, and toxins and other molecules can enter into the brain directly and then cause inflammation in the brain. We know from clinical studies actually in postmortem brains in autism that that population has higher markers that are to do with the tight junctions in the gut. So those are proteins that help regulate the sort of gaps that are between the gut cells that open up when you have leaky gut. So there is some quite clear evidence to suggest that gut health is very relevant in autism, and studies showing that gluten, for example, can exacerbate symptoms. There are studies in children in autism showing that excluding gluten and dairy can really bring about symptomatic improvement in that cohort. And then I've had other people contact me gaining benefits in terms of following a ketogenic diet or even a carnivore diet. So yeah, very interesting stuff.
See, to me, I don't know much about this area. I know more about type 1 diabetes than the sort of the whole sort of area of mental health. But the autism part is it's very interesting because we diagnose children with autism. So it's very different from dementia, which is the disease of the elderly. Although more and more, we're seeing more and more sort of younger people now being diagnosed with early sort of signs of dementia or Alzheimer's, one or the other. But so is it happening? Is it that the children are born with it? What do you think? What's your take on the sort of autism part? Are children actually born because of certain metabolic imbalances in their mother?
Quite possibly. So I was just going to mention there are studies showing that cohorts with a diagnosis of autism are lower in certain nutrients when you measure it on blood tests. So for example, carnosine and carnitine levels tend to be lower in that population. I don't know if there's any specific research into pregnancy and nutritional state of the mother, but certainly it wouldn't be a wild leap to suggest that the nutritional state of the mother, certainly during pregnancy, but also beforehand, may have some relevance. And obviously there are lots of other things that can happen during pregnancy that may affect the developing baby. But there are other aspects as well. So I'm just thinking there are studies that show that people with autism have different ratios of omega-3 to omega-6 fatty acids. So they have a more exaggerated omega-6 level versus omega-3. And we know these days that the ratio should really be close to 1-to-1, and I think the average figure these days is more like it's about 30-to-1 of omega-6 to omega-3, and that is because of the inflammatory fats that we consume within our diet, so specifically the seed oils, rich in linoleic acid, so seed or vegetable oils, people might know them as.